Welcome to the presentation on You Are One Borderline Away from Losing Your Psychotherapy or Mental Health License. I'm aware that the title may be upsetting, even shocking, and definitely politically incorrect. I know I should have said you are one borderline personality disorder patient away from losing your license. I am Ofer Zur, PhD, a licensed psychologist, ethicist, instructor, lecturer, expert witness, author, and most importantly, a critical thinker. In my forensic expert witness practice, I have encountered the most fascinating and intriguing cases where BPD clients have gotten their otherwise solid, experienced ethical therapists to go to extreme just to avoid the rage of the borderline patient. I've been involved in consulting, testifying as an expert witness in court and in licensing board hearing in my forensic work with accused therapists who have given cash to their borderline personality disorder clients, paid for their rent, lent them their car, stored items for them in their offices or in their home, regularly texted them at 1 or 2 a.m. in the morning, done some drugs with them, and even literally adopt them and let the BPD clients move with them, and yes, even having sex with them. So without doubt, it is a therapist's responsibility to maintain clinically and ethically and legally appropriate boundaries with all clients, including the PBD clients. However, this is easier said than done. There is no defense for therapists crossing the line and violating standard of care with his client. My only defense have been explaining to the court, to the judges in licensing board hearing, the power of the borderline patients. A quick look at the latest DSM definition of borderline personality disorder. It's a 301.83 states, a pervasive pattern of instability of interpersonal relationship, self-image, and affects, and marked impulsivity beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following criteria. 1. Frantic effort to avoid real or imagined abandonment. Very, very important. 2. A pattern of unstable and intense interpersonal relationship characterized by alternation between extreme idealization and devaluation. So go from one extreme to the other. 3. Identity disturbances, marked and persistently unstable self-image, sense, or self. Again, we need only 5 of the 8. Impulsivity at least 2 areas that are potentially self-damaging: spending, sex, substance abuse, reckless driving, or binge eating. 5. Reoccurrent suicidal behavior, gestures, or threat, or self-mutilation behavior. 6. Affective instability due to mark of reactivity of mood, such an intense episode of dysphoria, irritability, or anxiety, usually lasting a few hours, very rarely also a few days. Number 7, chronic feeling of emptiness. Number 8, inappropriate intense anger or difficulty controlling anger. Number 9, transient stress-related paranoid ideation or severe dissociative symptoms. Okay, so we need only 5 out of this list. At the heart of the challenge for therapists who work with borderline clients is how to remain clinically, emotionally centered, to be unaffected by the fear of the rage of the borderline client. Again, the fear of the rage is the biggest challenge. Therapists who work with borderline patients often violate boundary and act in an unethical, illegal, or counterclinical manner simply to avoid the borderline client's anger or rage. I use the word rage a lot because this is kind of what's so important to understand here, the fear of the rage. However, this is not always easy to avoid the fear or to stay centered. Borderline clients are so desperate for connection and attachment that the fierce need can draw a therapist in. At the same time, many borderline clients don't trust this very attachment that they crave, demand, or even when they get it. Thus, therapists can find themselves caught in their borderline client with conflicting desires. A growing body of research have indicated borderline can be treated successfully and effectively with competent therapists. Very important. Cognitive behavioral therapy seems to be one of the most effective clinical orientation with this client. Understanding the interpersonal power that the borderline clients exert on the therapist is essential for constructive treating of these clients and for protecting us psychotherapists and counseling from crossing the line. I remember in my early training 30 years ago, I reluctantly agreed to conduct session while walking down the streets of the town, rather than sitting in the office, just to avoid the rage of the borderline. Thank God I have a good supervisor who really told me, this is what you are scared of. You're scared of her rage. And it clicked really well, and I remember it ever since. I recently defended an experienced therapist who allowed a client unattentively to sit in her private office. She's a 30 years therapist with access to confidential information just to avoid the loud, profane tantrums that the borderline client was throwing in the waiting room when other clients were waiting around. So it's kind of a desperate act. So the question is, what therapy should do or not do to prevent boundary violation with their borderline clients? Do not deny or ignore the borderline diagnosis in order not to upset or enrage the client. I have worked with a lot of people who work with the clients but did not have it in the record that they are working with clients. That means consciously they did not deal with the complexity of the borderline. Second, get educated about treating the borderline patient. Recognize ahead of time to be aware of potential danger and hazards working with a borderline patient. Remember, they can wield an unusual power over many of us therapists experience and definitely not experience. Understand the power of intra and interpersonal dynamic at work in therapy with the borderline. Exercise extra caution with boundaries crossing with this client. An example of boundary crossing might include leaving the office with them the way I did 30 years ago, communication outside therapy, text or email, home visits, session at the therapist home. I heard a lot about that as well, and issues of touching. Watch out also for the most dangerous cognitive trap when working with a borderline client. It's if I only agree with his last request or demand, he or she will settle in, let go, calm down, finally realize that I do care. So this self-talk of therapists is one of the biggest cognitive traps. What you can do, of course, refer the borderline clients to experienced experts who are treating the borderline, and you can see it on their website that they are treating the borderline. Trying endless to appease or avoid the rage of the borderline is how therapists end up violating boundaries and getting into trouble. Consult with peers and experts on this specific topic. Not everyone can give you really the supervision that you need to attend to the borderline. When appropriate, document relevant boundary crossing, non-standard procedure, unusual encounters with the borderline, when necessary, including therapeutic rationale for such boundary crossing in your notes, and document boundary violations as well. Know the practice, the common principle of effective psychotherapy, such as cognitive behavioral therapy, which cut across virtual every modality, but the cognitive behavioral therapy seemed to be the most effective of working with the borderline. Learn to navigate the narrow channel of caring, compassionate therapy without getting sucked into the borderline client's emotional vortex. Again, overcome client's objection and refer out to therapists who competently and experienced working with the borderline. So whenever you try to refer them, you're going to get a huge tantrum. And so don't back away from that. Get consultation, explain why you need to refer them, and don't back away from that. Learn how to keep clinically and ethically appropriate boundaries without becoming disconnect, rejecting, or cold. This is what the cognitive therapists are so good at. Document everything, including consultation, and yes, even your boundary violation. In closing, do not ignore or deny the borderline diagnosis, especially at the very beginning. Notice your boundary crossing or violation or inclination to violate boundaries out of fear of the borderline personality disorder client demands or looming rage. Remember, you are one borderline away from losing your license. Consult, and consult. Document the consultation. Document client's requests and demands, and refer out to an expert experienced in treating the borderline. Good luck.